Hi, I'm Maggie. I'm going to be your nurse for today. So, how are you feeling? We're going to get you fixed up as best we can, okay? So today you're here for your Mohs surgery procedure. And so what the surgeon is going to do is that he's going to cut into your dermis and epidermis, and he will remove the section of cancerous tissue, which is your basal cell carcinoma, and he will take that circular incision of tissue and he will take it to the lab and they'll freeze it, and he'll look at it underneath a microscope and just to make sure that they removed all the cancerous tissue, and if they can pinpoint where exactly the roots of the cancer can be, so they'll go back in if they didn't remove it all in the first try and keep going and remove until they get it all, so that way it leaves the most minimal amount of scarring. This type of cancer is very common, especially in the US, and is basically just an abnormal, uncontrolled growth of basal cells, usually due to sun exposure, and since you're from California, it's very common. And these tend to look like a sore red patch and shiny bumps, kind of like urticaria, but a little bit different, more like bumps, less like hives. The person that will be operating, the surgeon, is usually specializing in dermatology or sometimes plastic surgery, especially because of the cosmetic deal with it being on your face, he or she needs to be specialized in plastics. And so the surgeon will use a scalpel, circular incision. He'll divide that circular little chunk of skin into 4 quadrants, so that way he can basically map out where the roots of the cancer are. And then he'll freeze those 4 sections using a cryostat in order to fully examine the cancer. Usually this surgery will last for around 4 hours, but we are asking you to really free up your whole day, so that way, depending on how many times the surgeon has to go back in and make sure that he or she got all of it, then that lengthens or shortens the surgery. Most surgery is micrographic, so the surgeon is going to do their absolute best to leave the littlest amount of scarring that they can, but due to it being on your face, there will be a scar remaining, but he or she will try their best to make it as small and as little noticeable as possible. And usually your body tries to naturally heal over the course of the year after the surgery, so it will get smaller as you continue to live on. And please make sure that after the surgery is over, you keep the wound clean at home, and so that way you won't develop any post-surgery infections. Those can be really serious, so make sure you take that seriously. And so we'd like to remove the stitches after about 1 to 2 weeks. So when do you think you'll be available? And it shouldn't take longer than a 15-minute appointment for the surgeon just to snip the stitches right out and make sure that everything's looking good. So, all right, we'll see you in 2 weeks.